Hello, my name is Dr. Nandini Chhabra, and today I'm going to talk about fine needle aspiration biopsy of the thyroid nodule. So, in this, we would cover a brief introduction of the procedure, indications of thyroid FNAC, pre-procedure preparation and precautions, the steps involved, post-procedure care, risks and complications, and finally interpretation of results. The thyroid gland is situated in the front of the trachea, below the thyroid cartilage, and is in close proximity with the carotid arteries. The function of the thyroid gland is to produce thyroid hormones, namely T3 and T4. Nodules are the most common problems encountered in the thyroid gland, whereas 90% of these are benign. This is how a solitary thyroid nodule looks like. It is most likely benign. It could be solid or cystic, hemorrhagic, adenomatous, or if it is cancerous, it could be papillary, follicular, anaplastic. So what is FNAC? Fine needle aspiration cytology is a very safe procedure. The cells are collected by using a fine needle of around 22 to 25 gauge, which is attached to the syringe. The study results will be available within 4 to 6 days depending on the local labs. The indication: primarily a palpable nodule or incidental nodule on an ultrasound. The biopsy should always be done in high-risk patients involving age of around 40 to 70 years, family history of thyroid cancer, MEN syndrome, radiation exposure to the head and neck, rapid growth in a previously existing nodule, hoarseness of voice, vocal cord paralysis, or dysphagia. The American Thyroid Association guidelines recommend ultrasound guided biopsy of all nodules more than 5 mm in high risk patients or with suspicious sonographic features. The red flag signs include a solid hypoechoic nodule with presence of microcalcifications, irregular borders, and high central vascularity. Before the procedure, we should always take an informed consent from the patient. We should do a full thyroid function test, including free T3, free T4, and TSH. A history of anticoagulants is very important, and if the patient is taking anticoagulants, they should be stopped 4 to 6 days prior to the procedure, if medically possible. FNA biopsy can be performed at an INR of less than or equal to 2. The position of the patients and instructions are very important. Lay the patient with the neck extended and place a pillow under the shoulders. The patient is instructed not to move their neck, speak, or swallow during the procedure. Also warn them that they might feel a pressure-like sensation in the neck during the procedure. So the steps involve localizing the nodule either by palpation method or by ultrasound. Use 1% lignocaine for anesthesia, whereas some clinics use only sprays or just ice. Insert the needle at a 45-degree angle into the nodule and aspirate slightly while repeatedly moving the needle through the nodule. Also, biopsy the lymph nodes, if any, during the same sitting. Make a smear of the aspirate on a clean slide and fix it with alcohol if needed. After the procedure, clean the site and dress it with a plaster. Ask the patient to wait on the couch for a few minutes to make sure they're all right. Patient can resume normal activity immediately after the procedure, but strenuous activity should be avoided for at least 1 day. The risks and complications involve bleeding, tracheal perforation, seeding of the needle tract by tumor cells, or a hypocellular aspirate, for which a repeated FNAC may be required. The overall accuracy of the FNA seed exceeds 95%. It is the most accurate method for evaluating thyroid nodules and selecting patients for thyroid surgery. The positive predictive value of a malignant interpretation is 97 to 99%, whereas the false negative rate of a benign interpretation is very minimal. For interpretation of the thyroid FNAC, there are 3 guidelines which can be used: Bethesda diagnostic category, the British Thyroid Association THY grading, and the American Thyroid Association grading. The THY grading is the most widely used, especially in our country as well, by which we can finally diagnose what kind of nodule is present and refer the patient for surgery as and when required. Thank you for your patient listening.